guys, in this video I wanted to cover the topic of spaying and neutering a bunny, also known as fixing. The terms refer to the removal of reproductive organs. Spaying is commonly used to refer to females and neutering to males. The process involves removing the testes in males and spaying, removal of uterus and ovaries in females. Neuter is less invasive than spay, therefore males tend to recover faster than females after the procedure. You can get your bunny fixed as soon as they reach sexual maturity, as early as 4 months old for females and 12 weeks old for males. However, it's not recommended due to the organs possibly not being fully developed yet, hence why the vets recommend to wait. Ideally, you should wait until your male bunny is 5 months old and female 6 months old. It's better to get them fixed as soon as possible and the earliest age, as when the female bunny reaches 3 years of age, they have 80% incidence of getting uterine tumour. In addition, after rabbit is 6 years old, the procedure becomes riskier due to the possible complications when they wake up from the anesthesia. That being said, it doesn't mean they can't undergo the procedure, it just means that the older the bunny, the riskier it might be. The process will normally take place in the late morning, and you will be asked to drop your bunny off around 9 AM. Your bunny will stay at the vet for the rest of the day so that the vet can monitor the recovery, and you'll be able to pick them up at the end of the day, usually around late afternoon. There's so many advantages when it comes to fixing your bunny, so let's just dive in. One of the biggest ones is the fact that it prevents breeding and unwanted pregnancies. Bunny's pregnancy lasts a month and they can breed again straight after they give birth. They also produce several kids in each litter. There's already an overpopulation of bunnies who are dumped to fend for themselves and given up for adoption on a daily basis, so fixing will decrease that. Rabbits who are fixed tend to be healthier and live longer lives. Female bunnies are at very high risk of ovarian, uterine and mammary tumours. Pyometra, which is an infection of the uterus and womb, can also occur if the female is not spayed, and it is fatal. Male rabbits are at risk of prostate and testicular cancer if not neutered. Both males and females can be aggressive if not fixed. Surgery lowers the testosterone levels significantly, which massively reduces the problem. Many females have repeated phantom, also known as fake pregnancies, and may growl, lunge at, scratch or bite the owners or other rabbits, particularly in the spring and the summer. They can also pluck out their own fur to build a nest. Furthermore, it eliminates territorial, destructive and possessive behavior. Spraying urine is very common in both males and females. They can mark the territory on the flooring, furniture, possessions, other rabbits and even the owners. Bunnies can be a bit destructive anyways because of the constant growing teeth, but the surgery will reduce that hyperactivity. Since territorial spraying is eliminated with surgery, your bunny will be able to learn how to potty properly and will be more diligent with it. A bunny is most happy if bonded to another rabbit, preferably with opposite sex or sibling. If both bunnies are fixed, they won't be territorial or aggressive with each other and will be able to bond safely. Keeping two unspayed females together, even if they are sisters, is very likely to result in serious fighting and the risk of injuries. Even though I believe that the benefits massively outweigh the drawbacks, like with everything, there's always some disadvantages. There's a risk of complications and possibly death, as with every surgery, both animal and human. Of course, when we go under the knife, there's always a possibility something might go wrong. Spaying and neutering costs can range from £50 to £100 per rabbit, depending on your vet practice and location in UK. Spaying is generally more expensive than neutering, as it's more complicated, invasive and takes longer. Sometimes it might be difficult to find a rabbit-savvy vet near you. Most vet practices are well experienced with spray and neuter surgeries on a bunny, but some are not, so it might be sometimes difficult to find the one that is experienced near you. Don't withhold any food before the procedure. Bunnies' gut should be continuously moving to avoid GI stasis, and they should be eating right up to the start of the surgery. Cats and dogs are normally asked to be fastened prior to surgery due to the possibility of them vomiting during or after the procedure. Bunnies don't have a gag reflex, so they can't vomit. Bring a bag of hay and some veggies with you so they can munch on them before and after the procedure. Also make sure they're drinking water up to the point where you have to bring them to the vet. If the drive to the vet practice is on the longer side, take some bottled water and a syringe with you so that you can offer them some in case they're not willing to drink from a bowl, as car drives are often very stressful for bunnies and most likely they will refuse to drink. Take your bunny to the vet for a health check a few days or couple of weeks before the operation if they haven't been seen over 6 months ago, to check if there's any underlying issues that might complicate the surgery. You can also ask about the procedure during that time. On the day of the operation, they will do a thorough health check and give you some paperwork to sign. The vet should weigh them in the consultation room before you leave them to make sure the correct anesthetic dosage is given later on. Bunny will be given anesthesia based on the weight. An oxygen mask and IV fluids will be administered to keep them hydrated. They will be constantly monitored by a nurse. The heart rate, breathing, temperature and eye lubrication will be checked throughout the procedure. If the bunny's temperature is a bit on a lower scale, some blankets and heat pads will be provided to keep them warm. To prepare the area, fur will be shaved off either on the abdomen, so the belly in case of the spay, or sometimes neuter too, and scrotum, so area around the testicles, in case of the neuter. The area will then be cleansed with an antiseptic. After the reproductive organs are removed, the vet will stitch up the area to close the incision, so the cut that was made. Nowadays, vets like to tattoo a green or blue line on the tummy to indicate that they have been fixed. Your bunny should be awake, alert and preferably eating when you collect them at the end of the day. Ask the vet about any pain medication if it's been prescribed, how long they should be on special rest routine for, and who to contact if you notice anything worrying. Nowadays, the stitches used dissolve on their own with time, so appointments should not be needed to remove them. However, a post-surgery appointment might be advised to check up on the healing process. Make sure your bunny is eating hay and veggies. Hand feed them if they're not willing to eat by themselves. Make sure they're drinking water. Use syringes to keep them hydrated if they're not drinking willingly. Your vet should give you pain medication to administer at home. They will provide you with all the information you need. Sometimes they may give you a comb for your rabbit to stop them picking on the stitches, or if they don't and you notice that they do, you can always ask for one. Monitor the stitches at least twice a day to make sure they haven't ruptured them and that they're healing properly. Males usually recover after 2 days, whereas females can take up to a week to get fully back to their normal selves. Set up a smaller recovery area for them for the first couple of days to make sure they feel safe and not bothered, and you can monitor them as well. A playpen with the necessities, food and water placed near your bed is a good option. I'm going to make a separate video soon on how to set up a recovery area and care for your bunny after the surgery. They will be groggy and sore for the first few days, so give them space as well as plenty of affection. Consider taking a day off the day after the surgery so you'll be able to monitor if they're eating and using the bathroom. You'll also be able to notice if anything is wrong. If you really can't take a day off or switch shifts with your colleague, ask a friend or family member who has a rabbit to watch them for you when you're at work. That's it guys, thank you very much for watching. Please comment, like and subscribe, and I'll see you very soon. Bye!